All right, we're going to wait just a minute to get started to let everybody come in. All right, welcome to the second week of the Ability Center of Greater Toledo's 4th annual ADA seminar. The Ability Center is a center for independent living in Northwest Ohio with a mission to advocate, educate, partner, and provide services supporting people with disabilities to thrive within their community. Continuing from last week, this year's seminar addresses familiar barriers facing people with disabilities that have become even more urgent within our current state of national emergency. Last week, presenters shared information on website access and barriers facing people with disabilities in day-to-day living during COVID, and we encourage you to check those out. This week, we will address emergency planning and health equity in the face of this global pandemic. Thank you for joining us. I'm now going to introduce our host for this seminar. Katie Shelley is a disability rights advocate focusing on public access and healthcare at the Ability Center of Greater Toledo. Katie received her Bachelor of Arts in English Literature from Western Michigan University, cum laude, her Master of Library and Information Science from Wayne State University, and most recently, her Master of Liberal Studies with a concentration in Disability Studies from the University of Toledo. Katie is very passionate about disability rights and endeavors to implement systemic change through her position as a disability rights advocate. Go ahead, Katie.
Hi, everyone. As Katie said, my name is Katie Shelley, and I wanted to welcome you to the third of 4 sessions as part of our 4th annual ADA seminar. The ADA seminar came about as a way for us to connect with ADA coordinators in our area and help educate them on what is required under the Americans with Disabilities Act. If you would like to be part of our ADA coordinator network and are not already, don't hesitate to reach out to me at kshelley@abilitycenter.org, and I will make sure you are added to our listserv. I send out a blog post on ADA-related themes every couple of months, and I keep ADA coordinators up to date on trainings provided. I am also more than happy to meet one-on-one with local jurisdictions in order to provide technical assistance on the ADA. Just some housekeeping items before we get started. We have one more webinar after today as part of our ADA seminar series, and it starts at 10 a.m. It's this Thursday, October 15th. We will have a panel on healthcare equity during COVID-19, where representatives from the Hospital Council of Northwest Ohio will discuss their collaboration with the Ability Center on the revision of guidelines for resource allocation in order to help people with disabilities in response to the COVID-19 pandemic. Reminder, if you registered for all 4 and attend all 4 sessions, you will be entered to win a grab bag with ACT, Ability Center, swag, including a Toledo is for Everyone t-shirt. Now, for today's webinar on emergency planning and disability in the time of COVID-19, we have with us Valerie Novak. We at ACT are very excited to be welcoming Valerie back, as she used to work with us in the advocacy program. And she was very instrumental in getting the first ADA seminar up and running. Valerie, whose pronouns are she and her, is a disability policy researcher focusing on inclusive infrastructure and emergency management practices. She focuses on integrating the expertise of lived experience and grassroots efforts of marginalized people into policymaking at the local, state, and federal levels. Valerie began her advocacy work at the Ability Center before going on to partner with national organizations. Valerie was a 2019 Portlight Fellow, focusing on legislative solutions to inaccessible emergency response practices in the U.S., and currently, she serves as a policy fellow with the Disability Justice Initiative at the Center for American Progress. Valerie has a bachelor's degree in Disability Studies and Urban Planning from the University of Toledo. She has a master's degree in Disaster Preparedness and Emergency Management from Arkansas State University, and she is currently pursuing a doctoral degree in Environmental Planning from Utah State University with a focus on inclusive infrastructure and land use. And before Valerie gets started, I would just like to remind you that we encourage you to ask questions, and Valerie will answer them at the end of the presentation. My coworker, fellow disability rights advocate Jimmy Russell, will keep track of those questions for us. So feel free to ask questions throughout the presentation, but if you do so, we do ask that you use the Q&A tab to ask your questions as opposed to the chat box. And now I would like to introduce Valerie Novak.
Thank you, Katie, and other Katie. It's really exciting to be here. This is Valerie, if you're calling in over the phone. It's kind of, as Katie mentioned, my mind's a little bit blown, so I'm sorry if I'm a little off. Just to be able to be back and to be speaking with you all at this seminar. I remember the first year that Katie and I work to put this together, and it's so exciting to see that it's still going on and what it has become, and how many different people in different roles have been able to take advantage of the seminar. So that's very, very exciting. I'm very glad to be here. We're going to go ahead and start off with a poll question. I believe Lisa's going to pull up a poll question for us regarding your preparedness, and I kind of want to use it to frame what we're going to talk about today. And this can be in your work or personal advocacy if you're here more as an ADA coordinator or just somebody who works in either compliance or accessibility. You can go from that route if you're an advocate and you want to look more personal. But we want to give a minute or so to kind of set how COVID has changed your advocacy, because we're going to talk a little bit about what the COVID-19 pandemic has kind of highlighted about some of our systems in 2020 and how that works into emergency preparedness. And I don't know, Lisa, is there a way to pull that up? Does it come up automatically when people have put in their answers? While we're waiting for that, I should do an image description, sorry. So I am a Black female with short curly hair. I'm sitting in front of, I don't know, kind of a collage of grayscale landscape photos, and I'm wearing a black and multicolored sweater because this morning we woke up and it was definitely fall weather, which was a surprise here in Utah. So that's the visual description if you're somebody who needs that. Okay, so we have the poll results here. So the first question was, how have you seen COVID change the focus of your work and or personal advocacy? 58% said yes, it's changed the focus of my work or personal advocacy. And the next 35% we have, yes, it has made the goals of my work or personal advocacy more urgent. And then 4% tied for other, and for no, my focus has remained consistent. And so what we're going to talk about today is broadly your work and where you might fit in as an ADA coordinator, but also just sort of setting the stage as disability advocates. The reason that I wanted to start off with that poll question is because one of the things that we've noticed with COVID is that a lot of the issues that are being highlighted now are issues that disability advocates have been working on for sometimes decades and decades and decades, that have now entered the general population conversation. And so the way that the PowerPoint I'm going to share with you today is very basic because I want us to have a little bit more conversation. But the first thing I'm going to do is kind of set the stage of where we are nationally and what COVID looks like. And I'm going to give kind of a lot of numbers and stats and information that is kind of going to set the stage of where our population is. I think a lot of times when we think about who the ADA is for, or we think about who we serve as advocates or as SILs, sometimes we can have a very narrow idea of who is disabled, who is part of that population. And so we're going to talk about some stats both nationally and in Ohio, so we have a better idea of who all is being affected. And then the second part, we're going to have a little bit more conversation, some more polls about how we can change or update or be more resilient to situations like this in emergency planning, because I know for a lot of people and in the past, a lot has been focused on personal preparedness, on things like go bags, where some of that has not really been super useful for a lot of people in a situation like we're going through now, a pandemic, which is a very different kind of emergency situation than say an unexpected flooding or a hurricane or something like that. So I'm going to go ahead and start my screen share here. There we go. All right. So again, my name is Valerie Novak. I am a disability policy researcher focusing on inclusive emergency management and infrastructure. So I'm going to look a little bit more specific at Ohio, but right now where we are as far as COVID, because that has colored so many of the conversations we're having. So the main thing and the main through line that I want to make sure that we're aware of is that the ADA does not become obsolete or less enforceable, and certainly not less necessary in situations of whether it's local or global emergency. I think often, particularly in something like COVID, where so much has been thrown up in the air and there's a lot of stress and confusion in trying to find your footing, for many of us who this might just be a function of our job, it becomes very easy to deprioritize something like compliance. But the reality of the situation is this is probably makes it more important than ever. It should be rising to the top of that priority list, because now we're really talking about potentially life or death. We're also talking about a potential major demographic shift in who needs access, and we'll talk a little bit more about that. So where we are today, these numbers were as of last night. I'm sure we've all learned at this point that there's kind of a bit of numbers floating around, and it takes a little bit of time for things to get updated. But the numbers as of last night, we're at over 7 million infections. We're at deaths of almost 215,000 in the US. Ohio specifically, we're actually closer to, and may even be over this point, 170,000 cases, and over 5,000 people have lost their lives to COVID at this point in Ohio. So this is definitely something that I'm sure you all have been facing in your day-to-day work. When we look a little bit more specifically on disabled communities, particularly, I know that Ohio has been looking at this as well, but across the country, nursing home deaths have been probably over 50%. The official number is at 40% or over 40%. Some of you may be aware, though, that the reporting on that is maybe a little absent. There wasn't a requirement for that reporting until a few months after COVID hit the US. We also know, and we'll talk a little bit about racial disparities here because it is very much becoming very evident in COVID. So one of the sources I have for you here is that very much like we're seeing in the general population, we're seeing the same racial disparities even in nursing homes. And so nursing homes that have larger non-white populations, and this does not mean majority, we're talking anything more than 25 or 30% of non-white residents in those nursing homes are sometimes seeing up to 76% increases in fatalities and infections for those nursing homes. And so a lot of those racial disparities that we see in the general population are also being mimicked within places like nursing homes. Specific to Lucas County, as far as underlying conditions, I know we've probably heard a lot, very frustratingly, of people trying to throw off that COVID doesn't really matter because it only affects, sick people or disabled people, which is a whole bit of ableism that we could unpack if we had more time. But even just on its surface, if we wanted to just go with that, according to the CDC, Lucas County has almost 50% of the population has one of the 5 conditions that the CDC is currently listing as potentially increasing your COVID risk. So even if we were going to indulge some of that ableist rhetoric of, well, we don't really need to worry because it only affects XYZ populations, in just one county of Ohio, that's roughly, almost 50% of the population. So we're not talking about a small group of people who are at potential additional risk for having a really negative or fatal COVID outcome. So other institutions, a lot of times this gets a little lost in the disability conversation, but we do have disproportionate amounts of people with disabilities in institutions broadly, not just nursing homes or psychiatric institutions. And so I wanted to talk a little bit about some additional institutional settings. The Autistic Self-Advocacy Network has attempted to pull together a list across assisted living facilities, group homes, institutions to get a better idea of how institutions broadly are being affected. I do have the source listed here. You'll have access to the PowerPoints. There's also some resources at the bottom if you'd like to take a look at that. But they're estimating, and I think last I checked, this was a few weeks ago, over 80,000 deaths across these congregate institutional settings of people with disabilities, and over 500,000 people infected just in the data that they're collecting. In the prison situations, we know that over 30 and 40% of people in jails and prisons are people with disabilities. There has been over 130,000 cases there, including the death of almost 100 prison staff, and over 1,100 people that are incarcerated have died. And so we do know, like I said, disproportionately, those are people with disabilities as well. I also threw in there the ICE camps here just to give us kind of an idea, because a lot of, especially more recently with discussions about things like public charge, the disability and immigration communities have found a lot of overlap in some of the advocacy work that's being done. This was particularly concerning. I had, for a different presentation, had talked about this a couple months ago. And at the time that I brought it up, the numbers that the government had were less than 100 cases. By the time I looked this up about a month later, ICE camps had 6,100 cases. And so it had just exponentially grown. And this is just people currently in ICE camps that have cases, not people that may have had the infection and are no longer there. So that number is probably much higher. So part of the reason I wanted to bring this part up is not only to broaden our idea of who we're advocating for, who the ADA is applying for, but also because traditionally when we've talked about emergency preparedness and when we've talked about safety in emergency situations, we tend to go to shelter. Because a lot of times what we're talking about is people who have lost their housing due to tornadoes or hurricanes or flooding or things like that. And so a lot of the issues that we deal with as far as accessible emergency preparedness comes down to accessible shelters, accessible bathrooms, parking areas. The pandemic has brought in a little bit different of a point of view, because congregating people is actually counterintuitive to trying to keep people safe from the pandemic, right? And so this kind of default of get people out of this one situation, we'll put them in this other temporary situation, and let's just make sure they have access to that, is no longer the kind of safe option that we're going for when we're talking about emergency preparedness, because putting people in those crowded settings not only has always been an access issue, but is now a safety issue. So when we talk about state and local government and some of the advocacy and legislative legal issues that have come up, I know Ohio has, I believe at the end of July, did get their agreement as far as crisis standards of care, but care rationing has been a huge conversation kind of from the beginning, as we started seeing COVID really take on. And this was one of the bigger ADA conversations, and really just discrimination conversations that were happening when COVID first hit. So we know at least 12 complaints were filed by partners like Center for Public Representation, the ARC, across the country. This covered a few different things. We had no visitor rules. Now this was really big for people who had direct service providers or home health assistants who maybe needed a parent or a partner with them. Crisis standards of care, which I know some of you may have worked on here in Ohio, as you had some amendments made to your crisis standards of care. But I read some very, very alarming, I believe it was North Carolina, that had an extremely vague, just like, you know, what's the quality of life estimate for this person, right? And what an open-ended thing to have to ask a healthcare professional to make a decision based on, right? Especially if that person that they're trying to make that decision for is maybe in a coma or something like that, and has no way of giving input on how much they might like their life, right? Inaccessible testing was a big thing at the beginning, where we were seeing some of these drive-through testing centers and things go up kind of overnight to help with the testing that people couldn't get to. And so there was a lot of different access conversations that were happening there. Institutionalization, we can talk a little bit more about this in detail, but there's been a long fight as far as people who do inclusive emergency management regarding the institutionalization of people in disasters. And so of course this is compounded in its effect during the COVID crisis. But we are still, as I'm sure you're aware, having concurrent emergency events happening at the same time. We have the fires on the West Coast. We've had a tremendous amount of tropical storms and hurricanes. We've had earthquakes in places like New Jersey. We've had interesting weather events, places like here in Utah, places like Idaho, where hurricane type weather has happened, even though there's no water to kind of fuel that, right? And so we've had a very, very long year of extreme weather events, of climate disasters, in which some of this institutionalization and sheltering is still happening, and trying to figure out how to do that safely while we're still also battling COVID. So one of the things that the disability community has fought against for a long time is certain aspects of what are called 1135 blanket waivers. Some of you on this, in this presentation might be aware of those. These offer a lot of different things. Like I said, it's a blanket waiver for CMS and Medicaid providers. And so there are some things that can be very positive that can come of this, and a lot of times things that are not so great. So right now there have been waivers issued for various things for every state and some of the territories in the US at this time. I put a little bit, and I'm sorry, it's kind of small down here, for the Ohio 1135 waivers. One of the things, and this tends to be part of where it gets a little contentious when we talk about community living, when we talk about Olmstead, is the waivers do allow a suspension of the review periods to determine whether or not somebody should stay or be sent to a nursing home. And so what we sometimes see happening when we don't have accessible shelters is often when we see it, but now we're also seeing it with filled up beds in hospitals because of COVID, is when people with disabilities when healthcare providers are able to use these waivers to not properly assess people with disabilities and just kind of quick transfer them to nursing homes. If you're somebody who does advocacy, like Money Follows the Person or home choice advocacy, you know how very difficult it can be to get somebody out and back into the community once they've gone to a nursing home or a rehab facility. And so the fact that they're able to suspend some of these reviews can have really, really harmful and long-term effects on people. And it has affected people feeling comfortable going to the hospital when they're sick, or seeking out what they need, in addition to some of the worry about the care resources. Okay, so we're going to talk a little bit about providing services, and then we're going to do another poll question, and we're going to have some more like discussion about what this might mean for you as either advocates or ADA professionals, and how we might need to start looking at emergency preparedness. So of course, home and community-based services. So this has taken a huge hit in an area that was already really, really experiencing shortages, experiencing low wages, lack of hours, things like that. But now, because of the COVID pandemic, the lack of PPE, the amount of clients a direct service provider might have going in and out of people's homes has created an extremely high level of risk for a lot of people who rely on direct service providers. Additionally, like all over the country, Ohio is experiencing that shortage, partially because of low wages, partially because of turnover rates. Those are at about 50%. And so you have a lot of people who either are foregoing by a decision of their own, foregoing some of the hours that they are allowed to have, or unable to get those hours. And so that's a major hindrance and barrier to not only long-term emergency planning, but just being able to stay safe in your community. Language access. This is an area that I think we often tend to forget about. I have some stats here that kind of talk about how large of a population we're talking about when we talk about language access and how varied that can be. So we know that over 30 million people over the age of 12 have hearing loss. So that might mean having captions, that might mean having an interpreter. Some of you may be aware that despite celebrating the 30th anniversary of the ADA this year, there still had to be a complaint and a suit filed against the White House for not providing ASL interpreters for the daily COVID briefings. When you have something changing as rapidly and as frequently as response to COVID, it becomes essential, and is always essential, but even more so when we're talking about potential life and death, to make sure everybody has access to that information. It becomes really hard to continue to advocate for ADA compliance on things like language access when even the kind of tip top of the federal government, where we should have the most compliance, we have to have complaints in order to get that information, right? But in addition to those of us that have that might have hearing loss or might benefit from captions or sign language interpreters, we have 67 million US residents who speak a different language other than English at home. That's over 20% of our population where they're not regularly speaking English at home. Generally, FEMA has been pretty good at providing language access. There has been an uphill battle trying to get really robust language access to a lot of the COVID information. When it was first coming out, it was only offered in English, Spanish, and simplified Chinese. Generally, it's pretty easy to get FEMA information in about at least 15 different languages, and that has not been as easily the case for COVID information. Just anecdotally and personally, I went on a couple week-long search trying to find information in Arabic for some Arab communities who were trying to make sure that that their communities were safe and could not find the information they needed in their languages. And then one thing that I think is really, really easy, especially as ADA advocates or professionals, is plain language. We're, even as disabled advocates, we're not always the best at doing this, but 1 in 5 US residents between the age of 16 and 65 has what they call low literacy skills. And so making sure that we're providing easily understandable information about how to prepare for emergencies, about how to stay safe in situations like COVID, is really, really essential to making sure we're getting out the necessary information to all the people that need it. And then sheltering and housing. So this has really been exacerbated, and I know so many of us are so spread thin and exhausted and have been fighting so long about better housing access. I think what is happening right now with the potential millions of evictions, with the increased amount of illness and death for our unsheltered citizens and residents, has really brought some of that housing conversation and accessible housing conversation to the general population. I am trying to keep my fingers crossed that maybe that means we can make some really huge headway as far as our housing conversation. But specific to Ohio, in 2019, the time count came out to about 10,300 people living unsheltered on any single day in Ohio. We know, again, this is a population we don't think about often, but 40%, maybe more, of unsheltered individuals are people with disabilities. So this is part of our community, and part of making that integrated and community living is accounting for our unsheltered folks. In at least one study in New York City, those who were unsheltered were dying at rates of about 61% higher than the general population. So we know that these individuals and these individuals with disabilities are greatly at risk, more so than the general population. And so I think we're going to go ahead and do another poll, and I think I need to stop sharing for us to do that. So there we go. And then Lisa, if you can do that poll, that would be great. And so this poll reads, how many of you have worked on personal preparedness for you and your family? And this again can also be work if you want to do work. And the 4 options, if you need them read, are I have, but it was long ago. It has not been updated or checked. I have and regularly update my plan. I have never worked on a personal preparedness plan, and I think about it, but haven't developed a plan. And so we're going to give you just a minute to go ahead and take a look at that. And this can be, you know, any level of preparedness. I'm not asking if you have, you know, all your, you know, two weeks worth of food and 3 days worth of water and all of that. But just, you know, is this something you've kind of worked on? Because I know a lot of people have at some point or another at least thought about this and maybe tried to put some things aside. So. Okay, so here we have our results here. So again, the question is, how many of you have worked on personal preparedness for you and your family? We have the top, actually 3 different responses tied at 26%. That's interesting. I have, but it was long ago, has not been updated or checked. I have and regularly update my plan. And I think about it, but haven't developed a plan, are all at 26%. And then 22% says, I have never worked on a personal preparedness plan. So this is actually really surprisingly evenly spread out. So we're going to talk a little bit about this and about what you can do either as personal, as an advocate, as an ADA professional, to kind of try to prepare for a little bit different of a situation than maybe what we've done in the past. So one of the things that has really popped up that disability advocates have been pushing for a long time, but isn't necessarily something you might find on like ready.gov, right? Which is going to have a lot of your go bag type preparedness stuff, which is very important, and we'll talk about that, but is the community response. So if you are an ADA professional and have not yet integrated yourself and really connected and built your networks with the, specifically in Ohio, with a tremendous amount of disability-centric advocacy organizations, I would say you're probably doing a disservice to the community that you're trying to serve in your county. Ohio and the northwest corner of Ohio has a robust network of SILs and aging agencies, things like the Site Center, that are wealths of information and have direct access to the people in which you are trying to make sure are living successfully in their community. And so one of the things that I think has really been highlighted in the COVID pandemic that's a little bit different, or that we really only hear about kind of more high level when we talk about preparedness, is how important it is to have those community networks locked in. So what we saw kind of across the board when COVID first started hitting and people started getting sick, and there was and has continued to be a lot of tension and contention between how seriously people want to respond to this. There was a myriad of mutual aid networks across the nation that spread up. Ohio has several of these as well, that were just community members trying to support other community members, getting people food that they need. I remember a big one when I was in DC. At the beginning, we had the toilet paper and the like cleaning shortage, and part of our mutual aid network was almost exclusively just getting people like wipes and gloves and toilet paper, because those were the things that people really needed. But the mutual aid networks kind of have always been there, but really came to the forefront. Centers for Independent Living. I know the protection and advocacy networks have been working with a lot of their protection and advocacy, ours would be Disability Rights Ohio, in all of the territories, in all of the states, to make sure that they're prepared with emergency preparedness tools. Other disability grassroots organizations and coalitions. I have 2 here, Sins Invalid and the Partnership for Inclusive Disaster Strategies are both disability-led organizations that have been doing a lot of work around COVID, and I have links for them further down on the resource page. And then of course your national and local organizations. I think I saw on here, we have at least the Toledo area Red Cross representative here. You have, Ohio has a wonderful emergency management association and hospital council who have all been doing work. And I believe the hospital council might be doing the next presentation, but have all been doing work in trying to make sure that the disability community is involved in that work. And so these are all places where, as an ADA professional trying to work through emergency preparedness, that you should be fostering and having some relationship with these people to make sure that maybe needs that you're not aware of or that you haven't heard are coming up. And then of course, we have religious and charity institutions that have really started trying to do a lot of work around COVID and generally pop up and do a lot of work in emergency preparedness in general. You see a lot of food drives and fund drives and things like that. And so these are kind of organizations that, whether we're talking about a hurricane or a fire or something like COVID, if you are an ADA professional or advocate that is doing work on emergency or that knows you're in an area where inclement weather might affect your population or some other kind of extreme weather event, these should be people that you know, people that you're having some kind of regular conversation with, because these are going to be the organizations that are on the ground doing innovative response to a lot of times with no funding and no support and no resources, trying to help the people that are being really, really strongly affected by whatever emergency situation is going on. So this is really, this is a untapped, I think, resource from a lot of ADA professionals. I think in addition, when we talk about, you know, blue sky times when we're not in an emergency, this also just better connects you with the people that you are that you're serving, right? If you're an ADA professional and part or all of your job is making sure that your jurisdiction is not only compliant but livable and enjoyable by the people who live there, you need to be able to have these kinds of conversations and know who those people are and the needs of those people. And so I think even when we're not in a disaster situation, being in communication with some of these organizations in your local areas is going to be really important to the work you do as an ADA professional. Okay, so tips to prepare. So these are not, like I said before, going to be your standard have 3 days worth of water and have a go bag and have an evacuation plan. Those are all very necessary. Those are all, like I said, I have some resources out there. I think probably a lot of you have looked at some of that stuff in the past. If you've looked at emergency preparedness, and you might also be the type of person who, like me, has found that when COVID hit, there wasn't a whole lot in that go bag that immediately assisted with the situation, because it's a bit different of a situation than what we generally tend to think of. And so I've kind of thought of a few other things that I've witnessed have been really useful in helping get people, organizations, communities what they need. So that first one is build your networks, and we just talked about that a little bit. Building out who you have as a resource, who you can contact to get information, who you can contact to find needs. One of the resources that I provide down at the bottom is a pod map. And if you haven't heard of pod mapping, it's generally done in kind of the justice and interdependence spaces. But pod mapping is a visual mental exercise that allows you to pick a particular issue. So say we say, you know, COVID response in this situation, and to sort of map out who your very close partners are, who are maybe partners you have a little bit more on the outskirts, and to really see and have conversation before an emergency situation happens, who those people are you would be in contact, and what everybody's responsibility is in that situation. So this might allow you to start looking at memorandums of understanding, different partnerships, maybe going outside of your jurisdiction. This might be something like transportation. This might be something like PPE. This might be something like actual physical space that might be needed for things like sheltering, right? And so I think COVID has made it very clear that none of us are in this alone. We should be leveraging those networks so that we can make sure everybody gets what they need. Don't delay. And this is a big one regardless of the emergency. I think it's just human nature for us to be very much think it's not going to happen to me, right? These things never happen to me. I'm never going to be the person that gets sick or whose house burns down or whatever the situation might be. And so we constantly delay putting off some of these conversations or getting, I'm losing my words here, but stocking up on things that we might need, right? Because yeah, we'll get to it someday, but I'm not in any immediate danger. I think COVID and the concurrent events of everything that's going on in all the different areas of the United States, suddenly a lot of people are saying, oh, it might be me, it might happen to me. And they're now trying to scramble along with everybody else to get what they need. And so don't wait for something to happen, especially now that you've experienced COVID. We've seen a little bit of what happens. I've seen some jokes floating around about, well, it turns out we don't all come together at the end of the world kind of thing. And it's kind of a sad thought, but I think for a lot of people, it's been a learning experience. And so you might know a little bit more about what you need if you can't leave your house. Right. And so now is the time to start working towards making sure those areas are covered, as well as having things like food and medicine. Have a plan. And so this one goes directly into kind of your traditional preparedness that comes out from having all of these, right? When you're not delaying, when you've built your networks, you're able to have a more comprehensive plan. And right now we are still in a situation, advocacy-wise, compliance-wise, where your plan should really prioritize your community and the people in your life. I would love to say that I think that we're in a place where your plan can really solely rely on things like FEMA or government response, but I think we've seen enough times at this point to know that that lets us down a lot, in part because we don't have that compliance there. And so if you're a non-disabled person, but your profession is in ADA compliance, and this isn't an area that you traditionally look at, and COVID has kind of pushed you into that, I really suggest you do a deep dive, look at some of the resources that we have here, because there's a lot of areas, and I didn't want to spend a lot of time talking about it, but in which disabled people are being left behind in these situations. And so having a plan has really required relying on your personal networks. That being said, you also do have the ability of building some of these relationships as an individual. You can be in conversation with your emergency responders to the area that you live in. You can meet those people, talk to those people, let them know the needs that you have. You can talk to your neighbors, other CILs or senior centers that you might be involved with, and start taking the initiative there to build some of those relationships yourself. Because I know that many of us feel a little bit of distrust on whether or not we be protected in some of these situations. And so having that plan that you've worked out ahead of time will allow you to know who you can go to and for what you need, and then get locked in. A lot of response is local and regional and open to public. And a lot of people are maybe not necessarily aware of this. Zoom has made it a lot more accessible for people. A lot of public meetings are now happening on Zoom, and so people that weren't able to go before are able to. But get involved in your area emergency preparedness. Sometimes our professionals don't know that there's an issue because they don't hear it from anybody. And so if you are a person who's able to and has time, whether as a professional, as an advocate, or just as a citizen and a resident of your region, go, reach out to your hospital councils, reach out to your emergency management agencies, see what meetings they have that are open. This might be your city council meeting if you're seeing that. So once you have a plan and you've built your networks, you can find those places to lock in and really be a tool to make sure that the governmental structures that are working on some of these issues are hearing from the community about what you and those in your community need. So I think I'm gonna go one more forward, and then we're gonna open it for questions. So our next slide here is just kind of the looking forward. And so this, I really wanna hopefully get your mind thinking for a bit so we can have a little bit of conversation. But how is this particular emergency year gonna change our cities and communities. I think COVID is going to do a lot for those, is going to have a huge effect for those of us doing ADA work or advocacy work. Something that they're now referring to as long COVID is kind of what it's being called right now, are the number of people who have been infected but who survived and are now having long-term physical, mental, neurological ramifications of the COVID virus. Right now, we're still very early into knowing what that's going to look like for people long term. But I have talked to people who have lost mobility post-COVID, who have lost lung capacity, who are experiencing things like long-term brain fog. So their memory and usage of words and things has been affected since they've had COVID. And so I believe there's going to be, when we look at those numbers of over 7 million people infected, we're looking at a massive increase in the number of people who are either temporarily or permanently disabled because of COVID. And so that's going to massively change how we look at access and who that touches. The default to congregated settings, like I mentioned before, a lot of our past advocacy and defaults in emergency situations, as far as response, tend to be getting people out of danger into some place that's safe, which is a bit of a different, looks a little bit different when congregate settings are the unsafe spaces. And we have not invested enough in allowing, in building communities where people have privacy of a personal home. And we just haven't invested in enough accessible and affordable housing to necessarily have spaces where we can make everybody safe in that way. Some other changes that I think maybe are silver linings to this, the increase of remote work and access. I was at a conference not too long ago, and one of the planners there mentioned that their public meetings had doubled in attendance as far as citizen members or residents because of people who could now access it via Zoom. They couldn't before, either because of transportation, because of childcare, any number of reasons, that were able to hop on their computer and hop on Zoom and join a community call. And so if you are a professional who maybe is completely zoomed out at this point, it's understandable, but should we go back, when we go back to some kind of normal, I would strongly suggest looking into what kind of access you were provided during this time, what kind of people were able to show up that maybe you didn't see before at some of these public meetings, and consider extending some of this remote access to some of these meetings, some of these informational sessions and things, because it has opened up access to a lot of people who didn't have it before. And then of course, access to the internet. A lot of people are becoming aware of the digital divide in a way that they weren't before. And one, how reliant we all are on things like internet, but two, how varied that is between location, like urban and rural, class, and who has access to the internet and how. A lot of people who were previously existing by having access to the internet through, say, a library, now have completely lost their internet because libraries are closed, right? And so you may have never noticed that they had a problem connecting to internet, or that they had less access, but that now has been massively exacerbated. And how will this change advocacy? So many of you said you're already seeing that your focus in your job has changed. For some of us, our focus has just been illuminated, right? Whether we're talking about access to care or healthcare or housing. And so COVID, I think, has been a flashlight on a lot of the inequities that we have been fighting against for a long time in our country, whether that's housing, transportation, healthcare. People who live at the intersections of multiple marginalizations have been feeling COVID in a much stronger way. And so that's definitely going to affect, hopefully, how we look at the disability community, how we look at the people we serve as ADA professionals or as disability advocates, that designation, I guess you can say, or identity spans across so many different types of people in so many different life situations, that when we start thinking about ADA access, that needs to be broader maybe than just getting into a restaurant, right? Or getting into movie theater, because those things are extremely important. But there are a lot of people who live outside of that kind of access and need access to sometimes much more basic resources than we might spend a lot of our time focusing on. And so here I just have some reports, some resources for you. So I saw one question about getting the slides. We will make sure that you all get the slides. The disability, the last one, I'm sorry, the Inclusive Disaster Strategies resource list is like pages and pages long. And so I included that here because there's a lot of resources on there. Some of these other resources are there, but there's a ton that are best practices, promising practices from other states, public comment letters, things like that have come out that might be useful for you, especially if you're in a professional capacity. But then we have the pod mapping guide here, some social distancing stuff from Citizens Invalid. So let's go ahead and open it up for questions. I'm not seeing a whole lot coming in here now, but we want to make sure that if you have a question or if there's something specific you would like to talk about or ask about as far as your advocacy or your professional space, I would love to have that conversation with you now. Thank you all for having me.
Yeah, this is Jimmy. I prepared some questions in case people didn't bring any to the table, but one I was going to ask is, how do you recommend overcoming maybe possible financial barriers to meeting the level of emergency preparedness that would make somebody comfortable? What strategies do you recommend to account for that?
Yeah, that's a great question. So one of the things that I often have to bring up in some of these meetings is that preparedness is cost exorbitant for a lot of people. It's really hard to worry about having extra food for something that might happen someday if you can't even get dinner on the table now. And so I think one, that's for the individual, that's where things like that pod mapping and those mutual aid networks come into play, having that community that can help you. But also it's a major missed opportunity or ignored opportunity on the part of our local governments. And so I think that's an issue that needs to be made more evident when we have some of those coalition meetings and things like that, that I think doesn't come up enough, is that just putting out there, well, you need extra medication or you need extra water, is not a solution for a lot of people. So yeah, so I think in the very real, like immediate circumstance, that's part of why having those personal connections is so important, so that people who can't access the things that they need, people who don't have the finances, especially now with the unemployment rate where it is, and they might not have, say, the SNAP benefits or things like that they might need, that they're able to go to that, to those mutual aid networks, to their pod maps, and say, hey, I really need, groceries for this week. But it's definitely a conversation that we need to be having more. FEMA, there has been a little bit of shift when we've talked about FEMA has gotten approval to do some wage loss funding, I guess you can say. And so it looks like there is some creative ways that people are trying to use some FEMA disaster funding, but that really is a conversation that we need to have more in our regional local governments. I think a lot of the response now has generally been to rely on your community anyways. If you were to call like a United Way, like 211 or something like that, they might tell you to go to the food bank or to go to XYZ big church in your neighborhood that happens to be doing a kitchen or something like that. So a lot of the responses we get anyways rely on your community. Having that a little bit more planned out will save some of the stress and anxiety around not having your needs. But it really is something that I think is important to bring up when we talk about having residents and community members in some of those emergency preparedness meetings.
Another question that we had here was, besides the Lucas County Board of Developmental Disabilities or Lucas County Health Department, is there a central state/federal resource for PPE for direction care professionals caring for our ID/DD clients?
So that's going to be a little bit different per state. So I don't know if Ohio has anything specific. I'm not in Ohio anymore, aside from the board of DD. So we've gone back and forth on the federal level. We keep hearing things that then aren't materializing on the state level as far as increased PPE, particularly for direct support professionals. It is something that we are continually pushing for on the federal level. I think a lot of states, California kind of had a ruffled some feathers a while back with their governor saying he was just going to start buying his own PPE from other states. Yeah, so, and Katie just posted that any health professional is eligible for the PPE bank here in Ohio through the Department of Health. So a lot of states have started taking, like I said, like California also has started just taking it into their own hands, because on the federal level, it's really been honestly just a mess of a lot of back and forth in trying to, it's become so mired in argument that it's just not moving fast enough for people to get what they need. And so a lot of different states are doing what they need to do and have a lot of different individual programs.
And now the next question is, do you have any advice for emergency preparedness for people who live independently, but are completely reliant on aid/caregivers?
Yeah, so a couple of things we've seen some people do, particularly if they have limited hours with their caregivers. So maybe they're just there a couple hours in the morning, a couple hours at night, and then they're seeing 2 or 3 other clients in the middle of the day. We've had some people who have just had live-in family members in the time being. They're not using their traditional professional direct service provider. That has not, depending on the person, that's either been fine or it's not been great, right? It's really stressful working with family that's living with you. A lot of times they don't have, often they don't have the training, they don't have, they haven't been working, some people have been working with their aides for months, or even some people are very lucky to have had the same aide for years, right? And so that hasn't been the most fun transition, but it's allowed to keep everybody safe. I've talked to some people who are just doing everything they can to take precautions. We've talked to people who are providing their direct service in essentially trash bags that are covering parts of their bodies to try to make sure that they can keep themselves and their clients safe. And so right now people are just trying to figure out what works best for them. I've talked to people who have aides that run errands for them but aren't coming into their house. So maybe helping them with groceries but dropping them off where there's no contact. So I have not seen a lot of like organizational recommendations. It's really been a lot of people, as we've always done as disabled people, right? Being creative in the moment and figuring out what works between them and their direct service provider to make sure everybody has what they need, or as close to what they need as they can. A lot kind of goes back again to that community. I think the most frequent thing I've seen is people having somebody who's staying with them that isn't their direct service provider and just having to forego their actual direct service provider services in order to keep themselves safe or to keep their DSP safe.
Thanks. Next question is, what is the best way to educate employees on the challenges that colleagues with disabilities, some that may not be obvious, might face during COVID? Yeah,
I think really, you can even do some kind of general examples to try to educate. A lot of, I think, what COVID has done is there's a lot of people who've never really found themselves or thought of themselves as somebody connected to disability that are experiencing a lot of the kinds of things that people with disabilities experience all the time. One of the things I'm really interested in maybe writing about or researching a little bit later is how the mental health effects of not being able to go anywhere. But how many people, we're here at an ADA seminar, that's their life. That there's so many places that they can't go, concerts and restaurants and sports events, because things aren't accessible. And then you have people who have never dealt with that, who are now feeling mental health ramifications of exclusion, right? And so I think there are ways, even just, if we're doing like persona examples, right, that you might have done in training, Susan has XYZ disability and experiences this. COVID has, I think, allowed a way for some of those experiences to be really, have become really general. Now people have a little bit of an idea of what it feels like to not be able to go out with friends, or to not be, and what being stuck at home, not because of anything you've done, but because, maybe there's, you don't feel safe being around people not wearing masks or things like that, right? Those are all different kinds of accessibility. It might not be steps that we normally talk about, but even remote work, if you work in a situation in which you've gone remote, how many employees you may have had that could have benefited from that before. That's going to be a much easier conversation in education to have with certain employees now that they've seen that experience, right? They know that that's not necessarily a drain on production or things like that, and is sometimes really necessary for people to produce where they need to. So I think it can really be used as almost a guide, because so many people are sort of experiencing an exclusion or experiencing a need for their employers to be flexible. We have a lot of parents who have kids at home right now, and they're asking for a level of flexibility that maybe in 2019 they would have scoffed at because a disabled employee asked for some flexibility, right? And so I think there's a lot of commonality that's coming from this that should provide a lot of examples.
All right,
I
and
know
this
we're
is,
up on time. I don't know if there's any other questions or if you want that to be the last one.
well, there's one question left, so it's up to you.
Yeah.
We can,
Yeah.
okay. Will our ID/DD populations be considered a priority group for the COVID-19 vaccine when it is finally available and all the side effects are worked out?
So that has not, I don't believe, at least last I checked, that has been like set in stone. There's a couple of different thoughts on that. So I know there are some people that are advocating for particularly, people that they're saying are at high risk or more vulnerable, people in nursing homes, people in congregated settings. So that might also include people with intellectual and developmental disabilities as being priority. There's also the argument that people don't want to continue being guinea pigs, right? So there's also people who are saying we want priority, but only as, once the vaccine is has been tested and is good. We've already had some complaints come in, and I want to say Texas, but that might not be the right state, where there was proposals to test vaccines in nursing homes and in prisons, and so of course that was a no. We're not here to be tested. We're not here to be experiments. And so, but right now, nothing, at least that I have seen, has been put into place as far as the actual dissemination of vaccines once that becomes available. That's still in talks and being worked out, and will likely probably be different per each state. I think that's going to be our last question, but thank you all for listening to me for the last hour. I hope I was able to provide you all some information you didn't have, and some things that might make it a little bit easier to do the great work you all are doing. Thank you.
Yes. And we want to thank you again, Valerie, for being with us today. And we really appreciate you taking the time to talk about emergency preparedness and disability in the time of COVID-19. Before everyone leaves, I just want to remind you that if you indicated that you are attending these webinars for CLE credit, please make sure that you fill out the survey that pops up as you exit this webinar. Click yes in order to get your CLE code. Also make sure that you provide your bar number to us so that we can submit the proper documentation to the Ohio Supreme Court on our end. And thank you so much. We hope to see you all again on Thursday